Of the floor to Dr. Pape.
Mr. President, ladies and gentlemen, it is with great sadness I'm reporting today on the terrible situation in my country. My name is Pape. I'm a professor of clinical medicine at Weill Cornell Medical College in New York and director of Geisio Centers in Port-au-Prince, Haiti. After completing my training in the United States as a specialist in infectious diseases, I returned to my homeland in 1979. My work in Haiti has always been both challenging and productive. I first started at the State University Hospital, the largest in the country, tackling infantile diarrhea, a condition that at the time was the leading cause of death in Haiti and many developing countries. I introduced oral rehydration therapy and other innovative approaches. We were able to manage in-hospital mortality and reduce it from 40% to less than 1% in just 1 year. From there, we expanded the program nationally with our unit as a national training center, and this program is credited with a 50% reduction in national infantile mortality. In 1981, I was called in to consult on adult patients with chronic diarrhea at the very same hospital. These cases turned out to be the first recognized patients of what we now know is called AIDS. This prompted me, along with 8 other Haitian professionals, to establish Geisio on May 2, 1982, as one of the first world institutions dedicated to fighting AIDS. Our mission was clear: to provide care, to offer training, and to conduct research. Today, over 40 years later, Geisio is one of the largest centers for AIDS and tuberculosis in the Americas, providing free care to over 300,000 patients. Over time, we've made incredible progress. AIDS, which was the leading cause of death in Haiti for decades, is now the 7th, responsible for just 5.6% of all fatalities. Meanwhile, cardiovascular disease has emerged as a #1 killer, accounting for 28% of all deaths. Even our AIDS patients are dying of cardiovascular disease. To tackle this, we established the largest center for cardiovascular disease in the country and identify hypertension as the main driver. In 2010, Haiti faced back-to-back disasters, a devastating earthquake and a cholera outbreak. Geisio stepped up, offering refuge to thousands of displaced people on our campus while introducing oral cholera vaccine to control the epidemic. This was the very first time a cholera vaccine was used during a cholera epidemic. It was highly successful and changed the World Health Organization guidelines to promote cholera vaccine during cholera epidemics, and has since been used to quell cholera all over the world. We've learned that in environments of extreme poverty, provision of healthcare alone, while necessary, is not sufficient. Global health that includes education and economic opportunities is a must. Beyond healthcare, we expanded our reach with programs like microcredit loans, a chlorine factory providing clean water to 100,000 people in nearby slums, a vocational school for survivors of sexual violence, and an elementary school on our downtown campus. On June 1st, 2023, I wrote an op-ed in the New York Times calling on the international community to help address the growing insecurity in Haiti. Unfortunately, the situation has only worsened since then. Haiti's economy has seen negative growth for 5 consecutive years. The capital is completely cut off from the rest of the country, and we're experiencing the largest exodus and brain drain in our history. Over 800,000 people have been internally displaced, and the rates of murders, kidnappings, rapes, and severe malnutrition have reached unprecedented levels. Most hospitals, including the State University Hospital, are now closed, and only 25% of medical facilities in the capital remain operational, placing overwhelming pressure on those still standing, ours included. How has insecurity affected our institution? 70% of the GESCO staff have left the country. Resignation letters continue to arrive weekly. 68% of our employees have had to flee their homes, very often with the only clothes that they had on, unable to get back anything else. In the past 3 years, 26 staff members have been kidnapped, more than any other institution, including 2 in just the past 2 months. Even my own son was kidnapped in November 2023 and held for 3.5 months. It was a tremendous ordeal for our family. But we've managed to survive by constantly adapting. We've developed a contingency plan continuously refined to every crisis, which includes having a backup staff for each critical position and offering ongoing training in medicine, laboratories, and IT. Also, our strong ties to the local communities have been essential to our resilience. But the reality is grim. How much longer can we continue operating under these conditions? Without your support, all the progress we've made in combating infectious and chronic diseases will unravel. It is very easy to share grim statistics, but they don't fully capture the human cost, what it really feels for the people who have to live through this hell every single day. What do we say, for example? For example, to a 13-year-old girl who was gang raped, became pregnant, and was too young to even understand what was happening to her own body. We'll help her deliver a baby she immediately rejected up to this day. What kind of future awaits her? What kind of future awaits her child? How do we console the man tied up in his home, forced to watch his wife and 2 daughters being raped and mutilated? In just the past 13 days since I've been out of the country, 2 young mothers were murdered. One was shot in front of her 4-year-old daughter, leaving behind 2 children, including a 1-year-old baby, and her husband was kidnapped last year, but made a sacrifice to stay in Haiti. The other woman is a newly trained neurologist. There are a total of 6 urologists in the entire country, who had recently returned to Haiti from the United States to serve her country. She leaves behind a husband and a young child. I'm here to tell you that the MSS mission, as you heard previously, is not working. Together with the Haitian police and army, they are outgunned and outnumbered. I clearly understand the controversies surrounding previous peacekeeping missions, but during their presence, and security did not exist at this scale, people could move freely, and farmers could transport their goods to market without fear. Nobody had to be in the streets because their house was put on fire. For a nation that once fought to abolish slavery and played a pivotal role in liberating South America, I trust that seeking your support to restore security in my country is not asking too much. It is a difficult task for any Haitian to request foreign troops on our own soil, but there is no other alternative. We sincerely hope that this will be the last time such a plea is necessary. In conclusion, Mr. President, I cannot think of a single Haitian living in this hellish reality who would not welcome a more robust international intervention. If nothing is done, the alternative will be a massive genocide that started already, something only you have the power to prevent. Thank you very much.